Have you ever wondered why colon cancer, once considered a disease of the elderly, is now increasingly affecting younger people? It's a question that has startled the medical community and the general public alike. The reality is, colon cancer, which was once predominantly seen in those over the age of 50, is now being diagnosed in people as young as their 20s and 30s. This shift is not just a random anomaly. Data across the globe shows a notable uptick in colon cancer cases among our youth. The disease, once dismissed as an old person's disease, has now become a pressing concern for all age groups. In this video, we will be shedding light on colon cancer, its symptoms, and the critical role of early detection. We aim to equip you with the knowledge you need to stay vigilant and proactive about your health. To understand this better, we need to delve into what colon cancer actually is. So, what exactly is colon cancer? Colon cancer, also known as colorectal cancer, is a type of cancer that begins in the colon or rectum, parts of the large intestine. This disease starts when cells in the colon or rectum grow out of control, forming a mass called a tumor. Not all tumors are cancerous, but when they are, they have the potential to spread to other parts of the body, a process known as metastasis. Now let's talk about the colon for a second. This organ plays a crucial role in our digestive system. It absorbs water, sodium, and some fat-soluble vitamins that haven't been absorbed in the small intestine. It also processes and prepares what's left of our food for elimination. When cancer forms in this vital organ, it disrupts its function and can lead to severe health problems. It's like having a roadblock in the middle of a busy highway, causing a traffic jam and chaos in the surrounding area. Here's something you might find surprising. Colon cancer is the third most common type of cancer in the United States. That's right, third most common. It's a significant health concern affecting tens of thousands of people each year. Despite its prevalence, many people are not fully aware of what colon cancer is, how it affects the body, or how it can be prevented and treated. It's important to note that colon cancer doesn't discriminate. It can affect anyone regardless of age, gender, or lifestyle. However, certain factors can increase the risk, such as age, a personal or family history of colorectal cancer or polyps, certain types of diets, lack of regular physical activity, obesity, smoking, heavy alcohol use, and certain types of inherited syndromes. Now that we know what colon cancer is, it's crucial to recognize its symptoms. Understanding the signs and symptoms of colon cancer is the first step in early detection and treatment. This knowledge could potentially save your life or the life of someone you care about. Remember, knowledge is power when it comes to your health. Recognizing the symptoms of colon cancer can save a life. But what should you be on the lookout for? The signs of colon cancer often masquerade as common health issues, which is why it's crucial to be aware of them. One of the most common symptoms is a change in bowel habits. This doesn't necessarily mean a one-off occurrence, but rather a persistent change over a period of time. You might notice more frequent visits to the bathroom, constipation, or diarrhea. Or perhaps you've noticed a difference in the size or shape of your stools. Another symptom to watch out for is abdominal discomfort. This can manifest as cramps, gas, or pain that persists and doesn't seem to be linked to your diet or other digestive issues. It's easy to brush off these discomforts as a minor stomach upset, but persistent pain is a red flag that shouldn't be ignored. Unexplained weight loss is another symptom that should raise an eyebrow. Losing weight without trying can be a sign of several health issues, including colon cancer. If you find yourself shedding pounds without a change in diet or exercise routine, it's time to consult a healthcare professional. Other symptoms can include fatigue, weakness, and unexplained iron deficiency anemia. Remember, it's not about experiencing all these symptoms, but rather noticing a persistent change in your health. Knowing these symptoms is a step towards early detection, but why is early detection so important? Early detection is a term we often hear when it comes to cancer, but why does it matter so much? Let's delve into this. Just as with any problem, the sooner we identify it, the easier it is to address. This is especially true with colon cancer. Detecting colon cancer in its early stages can drastically improve survival rates. In fact, the 5-year relative survival rate for local stage colon cancer, where the disease is confined to the colon, is about 90%. This is a stark contrast to the 12% survival rate for distant stage colon cancer, where the disease has spread to distant organs. Early detection doesn't only increase the chances of survival, but it also reduces the severity of treatment needed. When colon cancer is found early, it is often possible to completely remove the cancer during a colonoscopy, a non-invasive procedure that many people undergo as a routine screening test. However, when the cancer is more advanced, treatment can involve more invasive surgeries, radiation therapy and chemotherapy, all of which can have serious side effects and greatly impact a person's quality of life. The importance of early detection cannot be overstated. It's not just about increasing the odds of survival, but also about preserving health, wellness, and quality of life. So, we've learned about colon cancer, its symptoms, and the importance of early detection. But what are the key takeaways? Let's summarize what we've learned today. Colon cancer, once considered a disease of the elderly, is now increasingly prevalent among younger people. This shift is alarming, yet often overlooked, making awareness all the more crucial. The symptoms, though they may seem common, like abdominal discomfort or changes in bowel habits, should never be ignored. Becoming familiar with these signs is our first line of defense. The importance of early detection cannot be overstated. Timely screenings and consultations can dramatically increase survival rates and improve quality of life. Remember, it's not about living in fear, but about being proactive, taking charge of your health and well-being. In conclusion, we must all be watchful, not just for ourselves, but also for our loved ones. Encourage open conversations about health, promote regular checkups, and foster a culture of prevention. Remember, your health is your wealth. Stay informed, stay vigilant, and take care.